I'm Jessica Mannion at My Healthcare Direct, and I'm going to be going over what it means to be Medicare eligible, as well as some important information regarding what you're enrolling in, as well as some important information regarding enrollment periods that you should be aware of. So typically to become Medicare eligible, you're put into one of two groups. The first group is those of you who are either turning 65 or those of you who are retiring that are older than 65 and will be going on to Medicare full-time. The other group is those of you who are under 65, but you've been on Social Security disability for at least 24 months or 2 years. Typically at that point is when most people become Medicare eligible. So when you become Medicare eligible, there's two things that you typically enroll in. The first is Part A, which is your hospitalization coverage. Now, for most people who have worked, or their spouse, working for 10 years, paying into Medicare through their taxes, you get Part A completely free. So in most cases, most people get Part A for free. Now, the second thing you're enrolling in is not free. Part B, which is your outpatient coverage, such as doctor's visits, outpatient surgeries, as well as blood work, MRIs, things like that, you do have a monthly premium. And in this year, 2021, that premium is $148.50 a month. So for most individuals who are on Social Security already, they will deduct that from your Social Security check. So once you become Medicare eligible, regardless of if you're in Group 1 or Group 2, there's a couple of important enrollment periods that you should know about. The first is called your IEP, or Initial Enrollment Period. And this really affects those of you that are turning 65. You have a 7-month window to enroll in a Medicare plan, whether that's staying with Original Medicare and purchasing a separate Medicare supplement and prescription drug policy, or if you enroll in a Medicare Advantage plan. So that 7-month window starts 3 months before the month you were born in, includes the month you were born in, and 3 months after. So if you were born May 20th, your initial enrollment period would begin in February. So then you would have February, March, and April, May, the month of your birthday, and you will also have the 3 months after, so June, July, and August. So from February to August, you have that time where you can enroll in a Medicare plan. The second enrollment period to know is the special enrollment period. Now this typically happens when you're already on Medicare, and it'll be a qualification that you'd have to meet in order to change a plan. So for those of you especially on a Medicare Advantage plan, and say you move from one state to another, you typically are able to enroll in a separate Medicare Advantage plan that is available in the new area that you moved to. So you want to make sure to keep an eye on, if especially you're on an Advantage plan, that if you move, that you need to make sure that you have a plan that is servicing your area. And then another enrollment period that you want to be aware of is the open enrollment period, which is not to be confused with the under 65 open enrollment period that goes on in the fall. So the Medicare open enrollment period begins on January 1st and lasts until March 31st. So during this time, if you're on a Medicare Advantage plan, you can go ahead and switch to a different Medicare Advantage plan, or you can go back to Original Medicare and purchase a prescription drug plan. And last but certainly not least is the AEP, or the annual election period. Anybody on Medicare will definitely recognize these dates I'm about to tell you, because you will see tons of commercials on your TV during this time of year. From October 15th to December 7th, that is your opportunity to make a change, regardless of whether it's a prescription drug plan, a Medicare supplement, which really you could do at any time of the year, or your Medicare Advantage plan to take effect in January 1st. So that is probably one of the important enrollment periods that you're going to want to remember once you are Medicare eligible. So for those of you who are turning 65, or you're already older than 65, but you're going on to Medicare full-time, meaning enrolling in Part B, you can purchase a Medicare supplement plan without any health questions or underwriting. I like to call this, you have the golden ticket to Willy Wonka's chocolate factory. You're going to be automatically approved for your supplement. Once you're past that enrollment window, so if you're turning 65, that's that 7-month window where you can actually almost enroll up to 6 months before your birth month, you will automatically be approved and you won't have to go through underwriting. However, If you are past that window, then you will have to answer health questions. So it's very important to know if you're first going on to Medicare, especially Part B, you will be guaranteed to get on a Medicare supplement with no health questions asked. And finally, if you want to enroll in a Medicare Part D prescription drug plan, you must be enrolled in Part A and or Part B in order to be eligible for a prescription drug plan. If you have any other questions about whether you are Medicare eligible or have any other questions about enrollment periods or what plan you should go with once you are Medicare eligible, feel free to give our office a call at 888-959-1028. You can also find us on Facebook and check out our website at www.myhealthcaredirect.com.